Yeah, so first of all, that this is a kind of interim analysis for the open label extension study. I believe it's about 9 months since the double-blinded study phase was ended. Um, so to begin, double-blinded study was positive. Patients with THC to reduce their seizure frequency when they added, excuse me, CBD or Epidiolex in their case compared to the placebo effect. Now, we have to be very careful about what we're going to look at in terms of outcome measure during the open label extension study. To me, efficacy measure, which is a chunk of this poster information, may not be accurate for several reasons. Number one, even though many people believe it's 190 people entering into the open label study, it didn't really mention how many people still remaining at which level or which months specifically. I'm sure they have the data. And I just want to mention, even though it's a positive study overall and reporting good efficacy and tolerability overall, I just want to mention that there's quite of a limitation when we're looking at the open label extension study due to the fact that it is open label. That means patients can stop taking medications if they need to or want to. And analyses are geared towards those people who are doing well, both in side effects and efficacy. Obviously, those are the people who's going to continue to take. So more you look at and longer period you look at, you're really weeding out or selecting those people who are so-called winners or responders, and reporting the good report has a limitation. And second, because it's open label, people may change their medications, other seizure medications. Patients can actually have a VNS implantation if they want to, or other surgical intervention. I don't believe a lot of people actually receive that, but it is all possible. Anything they want to optimize their the seizure treatment, the clinicians can do that. So the efficacy may not all due to the fact that they're taking the CBD compared rather than the other measurement and the treatment they had changed. So we have to be very cognizant about it. I think the real value of open label extension study is to really the safety information. Is there any unexpected severe type of reactions and side effects can occur if you prolong the study period, right? So that's the main objective of the study. But oftentimes people kind of turn it around and more reporting their efficacy data rather than safety data. So good news again is there wasn't any surprising side effects that we did not know about. They reported diarrhea and it was a dizziness and or the somnolence and decreased appetite, which has been expected and which we knew about from the double-blind study as well as other studies. So in that sense, it is actually a very positive study showing that sustain the safety of this medication. Having said that, there are some people who did have some problem with the LFTs, liver enzyme elevation, greater than 3 times more upper normal values. And it really reported 8.5%. So that is something that we should be also very careful, because again, after so many months and weeks, there are still some people develop this kind of LFT liver enzyme problems later on. So the screening has to be continued for the time being, not just the first couple of months, maybe safe to do 6 months and even beyond that. To me, overall, the CBD has been very positive in terms of other seizure conditions they did, starting with the LGS, Lennox-Gastaut syndrome, and then the Dravet syndrome, now the THC. To me, the tuberous sclerosis has a more meaningful, because a lot of these people do have, in adult life, a lot of people do have focal seizures. Some people do have a generalized seizure, especially in the earlier onset, and the smaller children do have a generalized seizures. But in adult life, a lot of them will convert into the focal seizures. So if you look at the overall epilepsy population, 75% of people, 70 to 75% of people have focal seizures. Dravet syndrome and the LGS are both typical or the rare generalized epilepsy, typical generalized onset epilepsy. So we're kind of moving away a little bit from only addressing the generalized epilepsy, now getting to the more common realm, which is the focal seizures. And even though we do not know for sure other bread and butter type of focal epilepsy, not necessarily related to the THC, well, the question remains to be answered by the further clinical studies, and it will be very interesting to see whether CBD can be indeed establish itself as a broad spectrum medication for both severe conditions or generalized epilepsy as well as a focal epilepsy.